Hi, Kevin Henry, the Group Editorial Director for Advanced Star, and I'm on a Google Hangout today with our esteemed technology editor, Dr. John Fluke. I wanted to get your opinion, obviously, on technology heading into 2014 and what dentists should be doing as far as preparing their practice for not only technology but the training that goes along with that heading into the new year.
Okay, you know, one of the things that people need to be aware of is the whole budgeting aspect of this. And by budgeting, what I mean is a couple of things. Number one, a lot of people don't realize, but Windows XP, which is, I think the last time I saw the stats, like 85 or 90% of the computers on the planet are running Windows XP. That is about to lose support from Microsoft, and they are trying to migrate everybody, on down the system to Windows 7, Windows 8. And because of that, they're going to stop supporting Windows XP, and that means no more security updates or anything like that. So people need to be aware of the fact that they're going to have to migrate their systems to newer versions of Windows, and that's going to require some budgeting. The other thing about budgeting, this is just a general rule for technology, across the board, but especially for computers in your office. A lot of people will come to me and lament, "Dang, John, every so many years I got to replace every computer in my office, and it's so dang expensive to do so." And my response to that is, it is if you don't plan for it. And what we do in my office is we set aside money. We budget and we save, and we actually have a technology budget. A computer budget is a subcategory of that. And what we do then is we go ahead and every year we replace 1, 2, 3 computers in the office, even if there's no problems with them. The idea being that as we do that, we're not having to suddenly come in and replace every machine in the office, which is expensive. So we budget to replace little pieces instead of big pieces. And I think it's funny just in dentistry how we're, as a profession, we're very prevention oriented, and patients will come in sometimes and they haven't been in an office in 10 years, and then suddenly they get sticker shock by the fact that they need tens of thousands of dollars of dentistry. And our reply usually to our colleagues is, well, gosh, if they'd have just kept up with their recare, if they would have just come in on a regular basis and headed these problems off when they were small, they wouldn't have the big problems. And yet dentists then flip around and don't apply that same rule of thumb to what they do with technology. And technology is the same thing. If you do the small things on a regular basis, that helps you avoid the big problems on down the road. So it's all about prevention in my book.